ever heard of a black disc? Not this one, but this one. Your doctor says you've got a black disc and you need this, or this. Seriously? Why our discs become black? The spinal disc is a very important structure. They act as cushion, giving the spine flexibility. Because it has high water content and it appears as white on MRI scan, specifically on T2 weighted image. And this white appearance on the MRI scan will turn gradually into black. A black disc just means the disc is drying out. And if you have an MRI scan, you may want to have a look at the disc. How does it happen? We are all aging. The disc will become black sooner or later, and it is a normal degenerative process in the spine. But the more important question is, why do some people get black disc way earlier than others? So it is not just about age, it is about how you live. Sitting too much, sitting too long, that puts a lot of pressure in the disc. Smoking destroys the blood flow, depriving the disc of oxygen and important nutrients. Lifting heavy things with poor technique, that speeds up the wear and tear process in the disc. And lastly, poor nutrition or dehydration. That means less collagen and hydration for your spine. So yes, aging happens, but you can influence how fast it affects your spine. So, how do you know if you have a black disc? It is not easy because most of the time black disc doesn't cause any symptoms, no problem at all. But when the symptoms do show up, common symptoms include lower back pain. It can be chronic. Then back stiffness, especially after resting or after sitting for too long. The next one is pain that is worse when sitting, bending, and twisting. Sometimes pain when coughing or sneezing. And if the nerve is pinched, the person may experience pain, tingling, numbness, or even weakness in the legs or in the arms. What is the treatment of black disc? Again, no symptoms, no need treatment at all. Even if you are experiencing back pain and the MRI show a black disc, it doesn't always mean that the black disc is the culprit. Of course, the disc could be the source of pain, but not always. So before jumping to any invasive procedure, first, make sure the black disc is truly the troublemaker. Often it is not. So it is important to make a proper diagnosis. But even if the source of your pain is the black disc, you should try non-invasive options first, like physiotherapy, medication, and simple lifestyle modifications before considering more invasive treatment. Procedures like nucleoplasty and annuloplasty are sometimes used to treat black disc, but do they really work? Both nucleoplasty and annuloplasty are minimally invasive procedures using radiofrequency energy. Nucleoplasty is supported by low to moderate quality evidence. The guidelines recommend considering nucleoplasty only after failure of conservative treatment in selected patients. Again, selected patients, not everybody. Okay? What about annuloplasty? American Society of Interventional Pain Physicians, ASIPP, notes that while annuloplasty may provide pain relief in carefully selected patients, the evidence is inconsistent and not high quality. What about stem cell therapy? Stem cell therapy for black disc is still investigational or experimental. Some results are encouraging, but the evidence is considered low to very low quality. There is no strong guidelines to recommend it as a standard treatment. What about surgery? Okay, the evidence for surgery in treating black disc is moderate at best. We are talking about spinal fusion and artificial disc replacement as the treatment of black disc. Most RCT, randomized controlled trials, or meta-analysis show that surgery is not superior to conservative treatment for chronic low back pain without clear nerve compression. But for nerve compression, especially when causing sciatica, surgical treatment is strongly supported by high-quality evidence for providing pain relief and functional recovery when conservative treatment fail. So, surgery is best reserved for nerve compression, not just a black disc. If there is no pinched nerve, it is wise to avoid surgery. Black discs are a normal part of aging. Everyone develops them eventually, sooner or later. Many of them are completely asymptomatic, no problem at all. Not all back pain comes from a black disc. Even when it does, the first step, the first line of treatment should be non-invasive or conservative, not surgery, not any invasive procedure. Surgery should be reserved for cases of nerve compression, not just a black disc alone. I hope you get that, and see you later. Bye-bye.